What if we told you $15,000 could wipe out $1.8 million worth of medical debt? That might sound unbelievable, but that is the state of our current healthcare system. Thousands of Tennesseans are stuck with debt they can't pay, debt that in many cases is now worthless. News Channel 5 is trying to rescue you from that debt, and our Chris Conti shows us why this system is so messed up.
To know pain, to understand grief, is to see it on the face of Michelle Farden.
She was just a kind, caring, giving person. Unfortunately, she didn't always take care of herself.
Michelle's daughter Monica got a blood clot a few years ago. At the time, Monica did not have insurance. Not only did her medical bills pile up, but it scared Monica so much that she didn't go to the doctor.
The blood clot went to her heart, and that's what took her life.
When she died in July of 2014, Michelle was there at the hospital.
And, seeing her like that.
This heartbroken mother cannot help but wonder that if the weight of carrying medical debt might have been removed from the equation, would her daughter still be here? If she had health insurance, would she still be alive today?
Yes. I believe that. I really do.
Health coverage or not, it is a position thousands of Tennesseans have found themselves in, forced to choose between not going to the doctor or taking on medical bills they can't afford.
If a patient is so concerned about the cost that they're going to skip treatment, they're going to get sicker. And that doesn't help anybody.
David Fredrickson is CEO of Patient Focus. They help customers deal with medical debt that is often unforeseen and unaffordable.
The patient has no idea what they owe when they leave the hospital. Imagine going to a restaurant and getting the bill for your meal 60 days later. But you get a bill for the appetizer, you get a bill for the main course, you get a bill for the dessert, you get a bill for the coffee.
The medical debt system has become a complicated maze of debt buying. Those bills you can't pay for after the hospital often get sent to a collection agency. After not making any money, collection agencies will begin selling the debt over and over and over again, sometimes for pennies on the dollar. It essentially becomes worthless, and yet you, the consumer, is still stuck with the bill.
You're not looking at a real market.
Things are so lopsided that News Channel 5 was able to partner with the nonprofit RIP Medical Debt. We donated $15,000 to the group. They then went and bought debt in Middle Tennessee. Our $15,000 wiped out $1.8 million in medical debt. $1,897,326 to be exact. That money means that 604 people had some or all of their medical debt erased. Some of you may soon be getting this yellow envelope in your mailbox. Don't throw it away. Better yet, don't even open it. It means that some or all of your medical debt has been paid off. Because of HIPAA, all we know is that those people live in Nashville and counties around Middle Tennessee. It may seem astonishing that $15,000 equates to $1.8 million in debt. But that is the current state of the system that you, me, anyone in this country is dealing with.
It's a very confusing process. Nobody really knows what they really and truly owe.
If prisoners and people who break the law can get health care, why can't people who don't?
As for Michelle Farden, she knows there is no way to turn back time. She just can't help but wonder how many other lives are being lost, all because someone is too scared to get a bill.
Chris Conti reporting. We have to stress here, News Channel 5 had no control over who those yellow envelopes went out to. It was all done at random by a debt collection agency. But again, if you do get one of those envelopes this week, contact Chris Conti immediately. His information right now on the screen. We also have an entire special section dedicated to medical debt rescue on newschannel5.com.